So I'm sure you all looked at the agenda and thought something doesn't quite fit in with the rest, and that was deliberate, and I genuinely think this would be or could be one of the most important presentations of the day. So please bear with me, and I think it will be a really, really interesting presentation as well. So please can we welcome Reverend Kevin Fear, please.
I'm putting this up here because no doubt you all like thermal mugs. Go and buy one from the Samaritans because there's a really useful number on the side that just might change somebody's life. So this might be the most important slide for some people in this room. Statistically, 20 of you are right now experiencing stress, anxiety, and feelings of depression. So for some of you, these two numbers might be the most important slide that you see today. I'm going to talk about poor mental health, I'm going to talk about suicide, and that can trigger. I am sure that all of you have been affected in some way, either personally or through your family, with people experiencing poor mental health and maybe even tragically suicide. And that can trigger feelings within you, and I'm sorry if that happens to you. If you need to leave to go to the loo or take a phone call, please just put your hand up and say, I'm all right, before you go out, because I will follow you. And if you're going to the loo, particularly if you're a woman, that can be quite embarrassing. Vicar chases woman into toilet makes some really good headlines and often not in a good way. We work for a fantastic industry. It provides such good things. It provides better living for people. It provides good homes for people. And you are all part of that industry. These figures might be slightly out of date, but it doesn't matter. We employ lots of people. We give them good careers. But there is a dark side to our industry. And in 2020, this is John Prescott, used to be the Deputy Prime Minister. In 2021, there was a spike in our fatal injury figures, and those figures went up to 105. I am rather disturbed when I updated my slides to find that in 22-23 those figures had come up to 45. We were getting them down to 30 and below 30, so something is going on. And I don't even have to look at the data to know that half of those were people falling off things. But in 2021 we brought the industry together, and we agreed that we would start to focus on things like working at height. And what do you know, we did start to bring those figures down. So we started to look at safety. And then in 2010, the Health and Safety Executive published RR 800, which is looking at occupational cancer deaths in Great Britain. And what that did, this is a slide showing the opening ceremony of the 2012 Olympics. So they started to focus on occupational health. And what they determined to do was not just keep people's health the same, but to positively improve their health, which they did. And also, remarkably, something that is often overlooked, it's the only major construction for a sporting event in the world that has not killed anyone during the construction process. And they should be applauded for that. But also it enabled videos like this to be produced. while we're shouting safety and whispering health, and it is right that we do pay attention to health, there was absolute silence about mental health. And that is a surprise, because these are suicide statistics published by the Samaritans, and these are fairly typical. These are the most recent ones that I've got. So that figure there, 5,219. That's the total number of people who took their own life in 2021. That figure of 3,852 is fairly typical. Men are 3 times more likely to take their own life than women. And when you consider the number of men that are employed by the construction industry, don't look around, but I've asked for statistics on how many women are in this room. There's 11% of the people here are women. That is fairly typical of the construction industry. It is not typical of the industry on site, where it is only 1% of women are on site. And if you look at these high-risk categories here from Scotland, Wales and England, these are men, 45 to 54, 45 to 49. These are typical statistics for men on site, typical demographic of men who are on site. So if we've got these figures nationally, why weren't we looking for a problem on construction? It's because it is men. It's men. It's men of my age. What were we told when we grew up? When you fell over and skinned your knees, what were we told? Big boys don't cry. Grow a pair. Man up. When you go to the pub and you're talking with your mates, you're probably talking about football, all sorts of things. You're not sitting there saying, actually, mate, I feel really rubbish today. Those sort of conversations are just not a taboo. Men don't have those sort of conversations. And we need to get beyond that if we're going to make a difference. Men, as means to do self-harm, I don't need to explain to you the different ways on the construction site that you can harm yourself. Women are twice as likely to seek help than men. Either that's help from a friendship group or actually going to, there's somebody leaving. Are you about to leave? No, you're not. You're just walking to the back. Okay, I was just checking. They're more likely to go to the doctors to seek help, more likely to go for counselling to seek help. Men don't do that. Why? Because it's viewed as a sign of weakness. It's viewed as a sign as I can't cope. Therefore, if I can't cope, I'm inadequate in somehow. That is rubbish, and we need to stop that. Men are more likely to self-medicate. Do you know what that means? What does self-medication mean? Say again? Self-soothing. Yeah, what do you self-soothe with? Alcohol, drugs, either prescription or otherwise. We mask it, we hide it, we cover it in different ways. You don't need to go into this, but there's research that was around this time. Substance use disorder by industry, highest rates in the past month of heavy alcohol use. Construction workers were top of the list. And then substance abuse is a risk factor for suicide. That was in 2010. So the evidence was there, it was hiding in plain sight. But we couldn't actually see it. So what were the signs that something was wrong? And I was first alerted to this around 2014. I went to a construction industry bash. I think it was some awards or something. And I was in the health and safety bit, so they thought, we don't want health and safety people talking to others. So let's put them in a little table in the corner. We don't want them in the rest of the population. And I sat there in my clerical collar, and somebody sat there in a black tie. He had been told it was a black tie event. It wasn't. So he was the only one with a dicky bow on. I was certainly the only one wearing a clerical collar. And we looked at each other and said, okay, which one of us is at the wrong meeting? And he worked for Lend-Lease. And Lend-Lease is an Australian-based organisation, and mental health first aid started in Australia. And so Lend-Lease were attuned to poor mental health in construction. And he brought back the idea of mental health first aid to Lend-Lease and started training people in his offices. And he said to me, his guy's named Martin Coyd, an absolute hero. And he said to me, we're going to have a conference. We're bringing together the mental health first aiders to decide how things are going, what we need to do next. And I said, I want you to invite me. Which he went, yeah, all right. And that was the start of a journey towards building mental health, which we'll get to. But at that time, the best statistics that we had for suicide in construction was based on what they had in Australia, which is, they said in Australia, you're 6 times more likely to die of suicide on a construction site than you are through falling from height. So we took those statistics and thought, okay, we guess there's about 120 people dying from suicide every year in UK's construction industry. I then found a report from Scotland which showed occupation against suicide deaths. And I extrapolated the report from Scotland to the rest of the UK, and we thought, well, it might be around 250. Then a really important report came out in 17th of March 2017 from the Office for National Statistics. And this started to look at suicide by occupation. And these are some of the figures that they had. Low-skilled occupations had a 44% higher risk of suicide than the general population. Risk of suicide among low-skilled male construction labourers was 3 times the male national average. 3 times the male national average. And then you've got building finishing trades. Painters, plasterers, decorators had twice the rate of suicide as the national average. And along with this was a figure that came out, and I must admit I used it myself, which said 450 people every year in construction take their own life. And one day, while standing up on a stage similar to this, quoting that figure, I thought, where has that figure come from? And I went back to the report and read it cover to cover, and it wasn't in that report. So I thought, how are we actually going to bottom out what is the figure? Because if you can't measure it, you can't manage it. So I phoned up the Office for National Statistics and the equivalent in Scotland. And there's a thing called a SOC code, a Standard Occupational Code. And every occupation in the UK has this Standard Occupational Code, including Father Christmas, for example, which I was fairly amused by. And I went through and said, well, what do we mean by the construction industry, for starters? And I started to think, well, let's think about the built environment, not just construction. Let's think about the built environment. So I identified every standard occupational code for people that work in the construction industry. And this is only a snapshot. Electrical engineers, architects, steel erectors, crane drivers, property surveyors, flooring and wall tilers. And I sent all these figures back. Okay, these are the codes that identify occupations that work in construction. And against those codes, they have report from coroners' courts of deaths by suicide. And so what they then did was send me back the information, and I then collated it. And this is what we found. The real figures on this side were between 650 and 750 people a year dying from suicide in construction. I want to ask you to do something that might make you really uncomfortable right now. And that's, I want you to stop looking at me and look around this room. Don't worry, you don't need to talk to anybody. Try to catch people's eye. Okay? The number of people in this room represents 9 to 10 weeks of the number of people who take their own life in construction. The number of people in this room represents 3 to 4 days of the equivalent number statistically of the number that attempt to take their own lives in construction. It is hiding in plain sight. This pariah, I don't know what words you want to use, this thing that we need to do something about. John Bradley, you started this session 2, by saying we can't change the past, but we must try to do something about the future. Because I'm an amateur statistician, I handed my figures over to Glasgow Caledonian University to actually give some rigour behind what had been done, to try and work out really what is the suicide rate for construction. And they're coming up with figures like this, that the rate of suicide per 1,000 construction workers rose from that date to that date, and they're still looking into this. If you want to think about this in a way that hopefully you'll be able to remember. 120, 100. For every one fatal injury, on average, every one fatal injury, there are 20 suicides and there are 100 occupational cancer deaths in construction. And why is that? Why have I bothered put 40 times? You're 40 times in UK construction more likely to die from suicide than you are from falling from height. Why have I put that figure up there? Just think of the amount of effort the construction industry has gone into to stop people falling from height. Just think of the amount of training and briefings you get on site about not falling from height. Statistically, we should be giving 40 times that in terms of protecting our workers from poor mental health and suicide. There's other surveys, you can find them all over the place. Construction News has done one, 2022. 33% of workers avoided taking time off when struggling with their mental health. Nearly 60% hid the real reason why they'd taken time off. Nearly 60% did not receive appropriate levels of support from their managers. 3/4 say there's still a stigma around mental health in the industry. However, that figure there has come down. 2 or 3 years ago, that was 70 or 80% of workers who didn't want to share it with fellow workers. That's come down. 53% would feel okay about talking with their colleagues about their poor mental health. That is a sign that something is happening and is improving, but it's still not enough. In 2019, Construction News also published this. It was looking at the factors. What are the main factors do you view a major contributor to poor mental health? And it was these: long hours, job uncertainty, working away, tight deadlines, and financial pressures. The latest survey, 2022 survey, the financial pressures has come out on top. And if you think about all those, long hours, job uncertainty, working away, tight deadlines, financial pressure, they're systemic in the industry. What can you do to change that? Because we've got an industry that encourages people to work away from home. You've got men leaving work for work on first thing on a Monday morning and often not returning until perhaps midday Saturday or late on a Friday. Away from those normalising factors of home life. To change that is going to mean changing the industry. But we have to try and we have to start somewhere. Survey published by CABE, the Chartered Association for Building Engineers. 53% of SME owners experienced poor mental health in the last year. A third of owners survive on fewer than 5 hours sleep. Nearly 60% have experienced feelings of anxiety. There is so much evidence now that this is a problem that we have to do something about. Signs of distress, and this is probably to do with changes in behaviour. Poor time. Suddenly someone who used to be really on time is now poor timekeeping. I remember Martin Coyd told me a story that when they had a problem with drugs and alcohol on a site, they would test the whole site. They wouldn't just go in and do one test, they'd test everybody. If they've got a problem, they're going to find out where it is. And one site manager literally threw himself on the floor of the site hut and said, "If you test me, I'm going to take my own life." What no one had noticed was that this person was been coming in first in the morning and was leaving last at night. Any overtime that was going on a Saturday, he would be there. Why? Because his wife and kids had left him. And the only way he could get through Sunday, by not self-medicating with overwork, was to take cannabis, because his life was shit. Wisely, having found that out, that construction company has moved on from, if you find you've been abusing drugs and alcohol, you're dismissed. They've now moved on to saying, okay, what is going on for you that we need to work with you so that you can stop that dependency to start working normally. Obviously, you can't be under the influence of drugs and alcohol while on site, but what do we need to do to support you? So all these other things, risks and safety and risk taking, alcohol and drugs misuse, lack of cooperation, being tired all the time, they are signs of distress. I am hoping I've brought you all to the point that you're now convinced there's a problem. If I haven't, come and talk to me afterwards, because I need to work on you even more. I'm convinced, but what can I do? there's 11% of women in this room. If only we could get 50% women in the construction industry, will make a massive difference. Kevin Myers was a retiring chief inspector of construction for the Health and Safety Executive, and that's exactly what he said on his retirement speech. Somebody said, "What's the one thing you would do to improve the health and safety of the construction industry? What would it be?" And he said 50% women in the construction industry. Because there's a normalising effect by having women in the construction industry. And yet they only account for a very small number of people that work on site. This is where we come to building mental health. Go on to building mental health, it's buildingmentalhealth.net. It is completely free. You cannot transact with building mental health. It's not your money they want you to have the information in order to help those that are around you. We work in collaboration with the Lighthouse Club. No construction worker or their family should be alone in a crisis. So there's various steps that you can do. First thing is, there's a charter. I'll talk about that in a moment. There's a helpline pack. You can deliver toolbox talk. You can offer employees mental health first aid training. You can either get grants for that through CITB. Lighthouse Club offer it for free. I offer it for £40 a person. I don't charge for my own time. This is what the Charter says. The guiding principles of the Charter: provide awareness and understanding of mental health, train and enable champions, access accredited mental health first aid training, make it the main values of your business, recognise and accept the training provided by others. You sign the Charter. There's over 1,000. I used to have a slide which was a screenshot of the number of companies that have signed the Charter and are friends of building mental health. And it scrolls down. I can't do it anymore because it takes about 2 minutes. There's over 1,000 companies that have now signed the Charter and have said, we are going to try and make a difference. And if you're working for other companies, particularly the bigger companies, you might have to prove now that you're committed to improving mental health. Signing the Charter is one way of demonstrating a commitment to improving mental health. It can help you with your business. This is just a download of all the things that Lighthouse Club have helped people with. So where are we? So number of meals provided, over nearly 6,000 meals. Number of PPE and items of clothing, that 59. The Lighthouse Club is available for anyone who has a job associated with construction. That includes everyone in this room and your families. So it is a charity that is there for you in a time of crisis. There are toolbox talks which you can download for free. There's a film that goes with this. This is a guide for how you might deliver a toolbox talk. And they don't care whether you put building mental health on it or not. Plagiarize it. Put your own logo on it. It doesn't matter. What matters is that information gets out there. And this is one of the films that is shown.
Yeah, mate. Job's brilliant. It's going really well. Dry as a bone, no tea, no coffee, but listen, got to crack on. Need a favour. You know Steve? Yeah, divvy spread. I've got a horrible feeling he's not going to show next week. Can you try and sort us out a couple of lads to push the job on? Tony, you right?
How am I supposed to pay the mortgage? What's the wife going to say? What about the kids?
Got your reply from the chippy, mate? Mate, you're right. You don't seem yourself. I'm a bit worried.
Actually, no, I'm not, mate. I'm struggling financially. I
Right now, our human spirit is being tested to the limit. So if you see somebody struggling, don't stand on the sidelines. Follow these 3 simple steps. Number 1, ask twice. You often get a different answer second time round. Number 2, listen, non-judgmentally. Sometimes it only needs a sympathetic ear. Number 3, always be kind. Spontaneous acts of kindness can give people a real lift, and it makes you feel good too. You could be a lifesaver today. All it takes is someone to notice and care.
The one thing I will say about the asking twice. There is a myth about asking someone if they're feeling suicidal. Some people have got the idea that if you mention suicide, you'll be placing this idea in their heads. None of the evidence supports that whatsoever. And in fact, asking someone directly, and this can appear quite intrusive, are you thinking of taking your own life? Do you have a plan? Do you have the resources? Can be enough to interrupt those suicidal thoughts and can be the start of a road to recovery. You will not make it worse by asking those questions. And in fact, you could make it a whole lot better. I'll go back one. There's an app you can download completely free, Construction Industry Helpline app. It's got advice on there to help you about your mental well-being. It's also got prompts on there about financial support and other things as well that may be currently causing your mental health not to be very good. And there's direct links to the Samaritans, for example, for somebody that's in a crisis. And maybe it's on your phone and you're talking to somebody else who is in a crisis. Let's ring the Samaritans together. Let's do this together. Let's help each other on a way to recovery. Cost to companies. Signing the charter, it's free. Downloading the Toolbox talk, it's free. Use of the Construction Industry Helpline app, it's free. Downloading the training is free. The course, if you go on the general market, it's £320, £330 a person, but that's available free. There's a lot of changes we need to make. But let's look at one person at a time. Mother Teresa said, never worry about the numbers. Help one person at a time and always start with the person nearest to you. And the person nearest to you right now is you. Because if you are in a bad way, you're not going to be in much of a state to help somebody else. From my religious tradition, love your neighbour as yourself. And, even humanists would say, love other people, help other people as much as you would yourself. Sometimes we find we do more for other people than we do for ourselves. Do you set aside bits in your diary for do things that make you feel good? Talk about your feelings, keep active. You've heard all this before. None of this is new. But how many of you really put it into practice? Keeping active. There's a big correlation between physical fitness and mental fitness. And certainly mild to moderate exercise can be as good as some mild antidepressants. Eat well, take a break, drink sensibly, keep in touch, do something you're good at. I bet you've all got hobbies. I bet you've all, whether it's being an artist or playing music or doing something, you've let that slip. You don't do that anymore. Playing football, whatever, five-a-side, doesn't matter. And you've let it slip because jobs got in the way. Well, make time for it. Make time for it and ring fence it because it's important. Accept who you are. I wish I was 6'2". Hey, never made that one. Accept who you are. Ask for help. Asking for help is not a sign of weakness. It's a sign of strength. And care for others. It's a really odd thing. Volunteering, for example, in a charity shop. Caring for others, doing things for others, has a really strange effect on us as well. It can make us feel good, and it helps other people. That's my email address, that's my telephone number. I don't know whether there are any questions. It doesn't matter if there's not, but I'll put that up again, because that might be the most important slide today. Thank you.
Well, that was hard hitting, and I appreciate, it's a change of tone and pace from a lot of the stuff we normally do at these conferences, but I hope you all see the value in it and it's worthwhile. We are ahead of schedule, so I'm still hoping, will food be ready? Food should be ready, so hopefully we can sort of we've got time for questions if anyone wants any questions from Kevin, or perhaps if you want to do it in a more low-key way, then that might be.
I'm around afterwards if anyone wants to come and talk.
Kevin, I'd just like to say Lighthouse Club, I put all of my guys and girls on it 2 years ago.
Yeah.
3-day course, absolutely empowering, absolutely brilliant, and you learn some really good vital things that you should need to know for the future. So it's absolutely brilliant.
Do you all hear that? Give him the microphone.
Where's the road? Oh, there we are.
No, I've just said that. Yep. Can you hear? How's that?
Yeah, there we are.
No, I was just mentioning that I put all of my guys and girls on 2 or 3 years ago within COVID, and it was a brilliant course. It was a 2-3-day course through the Lighthouse Club. Very empowering, brilliant, eye-opening. Some of the people that was on there, hearing some of their lives, how devastating, how this was their release, how they learnt a massive amount, and they were sharing that thoughts with other people as well.
Yeah.
Brilliant. So, I do.
That's the mental health first aid course, is it?
Yeah.
Yeah.
Yeah. So I encourage anybody, if they've got the time, or anybody like that needs to have it, or, even as Toolbox Talks, like you say, be brilliant to share.
Mental health first aid course is a 2-day course. The way I offer it, and lots of other people do offer it, it's 4 mornings. It's a Monday, Thursday, and a Monday, Thursday the second week. So it's I do it online. Other people offer it online. I'm not just I'm promoting the course, not me. So if you can find it locally, then I would highly recommend that you do that.
Yes, I'd like to thank you very much indeed for that talk. I speak from someone who's, I lost a colleague a few years ago through suicide, professional practice. No one had the first hint that there was anything wrong. In fact, he was the life and soul of the office.
Yeah.
And I can think how much devastation it caused and the ripples, etc. But the other thing I just wanted to add is, if I may slightly piggyback on this platform, just simply to raise the profile, the importance of what I think are 2 of the most important things that we can grapple with. One is obviously the technical competence, which is what we're about, but number 2 is the absolute necessity for emotional intelligence.
Oh, yeah.
It's not just what we do, it's how we do it.
Yes.
And if we really grapple with that, and I'm really thinking about policymakers, particularly leaders at every level, if they embrace the understanding of the neuroscience, the profound change would be immeasurable. And I think that this really keys right into what you said, and I really applaud you for doing it and hope you have a great success in doing what you're doing. Thank you.